You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. I am excited to be joined by Dr. Marlon Garzo Saria. Dr. Saria is a nurse scientist and magnet program director at Providence St. John's Health in Santa Monica, California. He is also a lieutenant colonel in the U.S. Air Force Reserves and is currently assigned to the 452nd Aeromedical Staging Squadron at March Air Reserve Base in California. Dr. Saria is the president of the Philippine Nurses Association of America. Dr. Saria earned a bachelor's degree in nursing from the University of Philippines and a Master of Science in Nursing and a Doctor of Philosophy from the University of California, Los Angeles. He received a master's in military operational art and science from the Air University, U.S. Air Force. He is board certified as an oncology nurse, oncology clinical nurse specialist, advanced nurse executive, and nursing professional development specialist. Dr. Saria has held educational research and leadership roles in various settings, both nationally and internationally. Dr. Saria is a fellow of the American Academy of Nursing and a fellow of the Academy of Diversity Leaders in Nursing. He has received several awards of distinction from the Oncology Nursing Society, the Global Caring Nurses Foundation, the University of the Philippines International Nursing and Healthcare Forum, the University of Philippines Nursing Alumni Association International, and the Philippine Oncology Nursing Association. He's got a much longer bio. I am going to make that available to everybody on my website, so please check it out. He has done a lot more stuff. With that said, I'm going to welcome Dr. Saria to the show. Welcome.
Thank you, Dr. Tayeb.
Call me Ali, please.
Here. Thank you, Ali. Call me Marlon as well.
Will do. Right. So I'm gonna, first of all, before I get into my regular question, how do you afford to keep all of those board certifications up to date? Because there's a lot of them in there. I'm just kidding. You spend a couple of bucks on your board certifications, so
yeah, they're not cheap. But it helps to have an organization that supports professional development.
Absolutely. I agree. So we'll get to my first question with all my guests is, how did you get started in the world of nursing?
Nursing, I did not choose nursing. Nursing chose me. I was in the Philippines. High school graduation. At that time, I actually wanted to become a Catholic priest. So I was at a Catholic high school in the Philippines and was very much involved in all the religious life. The seminary that I applied to turned me down. Well, thankfully, my grandfather, who was in the U.S. at that time, he was a United States Armed Forces in the Far East veteran. And then he was in the U.S., wanted me to either take up physical therapy or nursing with a plan to actually get me to the U.S. I applied to the physical therapy school at the University of the Philippines and was turned down as well. But then they told me that, they'll, my words, not theirs, they'll dump me over to nursing, which had a quota as well. It was very difficult to get into nursing, so I was surprised I actually got in.
Wow, amazing! A lot of hands in play for you to get you into the nursing program. So when you got into the nursing program, with the understanding that this was in the Philippines, did you have any idea what you're going to be experiencing, or was just like, hey, I'm following the guidance of my was it your grandfather?
My grandfather, yes.
Yes.
Uh, First, we did not have a nurse in the family. And I'm the only child, no older brothers or sisters. So no one really to look up to in terms of college life. My mom and dad were did not finish college. And so I got into school and just my goal was to graduate. Yeah.
Hmm.
I was not really in love with nursing at that time. Yeah, I was just barely getting through the courses, and I just wanted to get a passing grade to graduate.
Wow, amazing. So you go through your nursing program. What brought you over to the US?
So my grandfather, Apolinar, had a big hand in that. He already filed a petition, maybe 12 years before I graduated.
Oh, wow.
Like you said earlier, lots of hands involved in me becoming a nurse. There were lots of uh, fortunate events in my life that happened. Like perfect timing that I couldn't have for ask for anything better. Uh, First of all, I graduated from my nursing program. Our papers from the U.S. came, and I was able to fly to the U.S. 2 months before I turned 21.
Oh, wow. That's amazing.
Yes, I was able to join my mom and my dad. The petition was actually for my father, but because I was a minor at that time, under 21, I was able to fly with them.
Oh, wow. That's amazing. Now, had you had the opportunity to practice nursing before you came over?
No. Uh, so graduation in the Philippines is in April. I did take the review courses to sit for the board exams in May. But the University of the Philippines did not release our papers in time
Ah,
for us to be able to sit for the board exam. So when I flew out in September, I did not have a license. The next board exams were offered in December, so uh,
oh, wow.
it just did not work out time-wise for me.
Yeah. So they only offer the board exams twice a year. Is
Twice a
that fair?
year. At that time, I
Oh,
don't know if that's still the case though, but at that
okay.
time, yes, it was only twice a year.
Oh, wow. That's amazing. So you came here, I take it, and then you sat for the boards.
I did. It was easier for me. I know it's a lot more difficult for those who are trying to get here on a work visa or recently with all the immigrant visa for nurses.
Right.
They have to go through many hoops. Take the CGFNS depending on where you are, what state you're in. A lot of criteria before you even qualify to take the board exams. But because I was an immigrant, a card holder at that time, it was really easier for me.
Yeah, I'm sure. I'm sure. Yeah, that's amazing because there was a time I don't know, I don't think that it's still the case, but we used to uh, have incentives for nurses from the Philippines, right, to come over to the US. I know that was a program. I know the military, especially the Navy, was a huge proponent. Having served in military, I had a lot of service members, colleagues that were from the Philippines. So I was well enculturated in the Filipino culture, being
Yeah,
in the Navy,
true.
between the families and the food and amazing, amazing. Actually, my recruiter out of LA was Filipino, so very well enculturated into the Filipino culture. Just spent a little time, spent a few weeks in the Philippines with some operational stuff too. So amazing. So tell me about your experience of starting your career, having studied abroad, starting a career in the US. Anything different, or everything kind of fell into place for you, or was there like a shift in? I know there's always a little bit of a culture shift, but being an immigrant myself, but how did you adjust?
Well, finding a job was the most difficult thing I had to do. So I was able to sit for the boards. I got my license after taking the board. Uh, and I applied to all the hospitals in San Diego at that time. And I got the same response from all but one.
Yeah,
And the response was, come back to us when you have more experience.
of course.
So I did not know if that was the same for those who graduated here in the US versus an internationally educated nurse like me at that time. But I did not think that I could even land a job. So I applied to other alternatives. Was a caregiver at some point just for a few months, and then applied to a long-term care facility where I was actually accepted. And my first job as a nurse, as a licensed nurse, was a charge nurse. Can you imagine that?
Oh, wow.
Someone who doesn't have an experience being a charge nurse because I'm in charge of all the LVNs and the LPNs
Right.
facility at that time, and then there were shifts that I would be the only nurse.
Mm.
Uh, so imagine being an internationally educated nurse, the only nurse, thinking about all the disasters and emergencies that could happen that I will have to manage myself. That was a scary thought.
Yeah, that's a
Uh,
quite an induction into the world of nursing. Like, well, welcome. Here's all the responsibility right off the bat.
yeah. And then I decided to take some certifications courses just to expand my resume a little bit because it was like probably half a page. There was not a lot on there. So I took an IV phlebotomy course, ACLS, BLS, just to keep adding things on it. And in one of those courses, I met a nurse who told me, "Do you know about the U?" And I just asked, "What's the U?" It's the University of California, San Diego. Uh, a little bit of a background here. That this was 1998. I came from the Philippines. There was no such thing, or maybe I shouldn't speak generalize all the hospitals in the Philippines at that time, but online application was not a thing.
Yeah,
You physically go to the hospital, fill out a form, a biodata, right,
right.
to apply. And so that's how I did it here. I went to all those hospitals, went to their HR department, filling out forms. Uh, when I heard about the said I could apply online, so that was of course something new for me. I still went to the HR department and I filled it up online in the HR office in San Diego at that time. And I'm just really fortunate that one of the managers, so it's Filipino, saw my half a page of resume that I graduated from the University of the Philippines and granted me an interview.
Mm.
And the rest is history.
Wow.
So she offered me a position in the oncology unit. Actually, it was a blended oncology, med surge, bariatric surgery, renal and kidney transplant, I mean, liver transplant unit at UCSD at that time. And I took that job
Wow.
as a new grad.
Wow. Beautiful. Beautiful. And I'm sure that's what led you to all the accolades and all the oncology certifications and things like that. So you fell into your specialty sort of by accident. You weren't really
Right.
looking for it.
That's right. That's right.
Yeah.
Funny story. When I was when during that interview with the manager who hired me, so she asked me what I know about chemotherapy. And again, this was 1998. I told her that when I was on the oncology unit in the Philippines as a student at that time, I was assisting administer chemotherapy. And of course, she was shocked to hear that because of all the policies and procedures we have surrounding chemo safety here in the US at that time. So
Right.
again, this was 1998. Things have changed a lot, and I know because I go back to the Philippines, making sure that we have those changes. Uh, but yes, at that time, I was already assisting, even I would say mixing chemotherapy on the unit as a student.
As a nursing student.
Correct.
Oh my God, that's quite interesting. Yeah, I recently was talking to a colleague, and she mentioned how they were still using the dial-a-flows. And this is in the US. They're still using the dial-a-flows. I'm like, I didn't even know they still manufactured dial-a-flows, let alone we're still using them here. So it's amazing that she said I had a brief opportunity to be in the Philippines when I was in the military. We had one of the they have like part of the visits that they do the military when they visit the Philippines. Sometimes they do a community uh, event type of thing. So we spent like 3 days, all the medical and dental people providing medical and dental care to this rural area. It was in Ternate, Cavite,
Yeah,
in the Philippines. So, but this is back in 2000, I want to say. So it's a while back, but I spent a few weeks there, and it was amazing to see the rural area and how much care that they needed and they didn't have access to it. So it's always great to be able to provide access. So I appreciate you going back to the Philippines and updating and making sure they're up to speed and uh, getting it right.
interesting. You mentioned Ternate, so I do have relatives from my paternal grandfather,
Oh, really?
grandmother side from there. It's not that far away from Manila. And if for those who
Yeah.
are not familiar with the Philippines, most, if not all, of the major medical centers are in Manila. Uh,
Yeah. Yeah.
and the major
Yeah.
metropolitan cities and on the islands. But if you're even just 2 hours away, then you have your local community hospital, and then everything else will have to be done. Yep.
Yeah. Yeah. Like
Mm.
I know like some people had walked like a day just to get to us. So they didn't but yeah, but the ship after we were done with all of our operations, we were working with the Philippine Marines at the time, doing some operational stuff as well. But when we were done with that, we had a couple of days in Manila. So enjoyed the food and a lot of handcrafted stuff. Love that. Kind of went crazy on that. But yeah, it was a really very eye-opening and engaging experience. So loved my time there. Slept on the beach for a couple of weeks. Couldn't complain about it.
It's awesome.
In a hammock. So couldn't complain. Couldn't complain. So let's talk about your career as you've moved along. So you had your exposure to oncology. What made you say, you know what? I need more education. I want to do higher levels of education. I need more certifications. How did you decide you're going to get engaged with everything that you've done through your nursing career?
So it's very important to share the timelines. I told you that I came to the US in 1998. 1999 was when I got my license.
Yeah.
And then a few months, about 6 months, maybe after that, no more than 6 months after that, after having tried all those other jobs, was when I was in a new grad program. So that was 1999. 2 years later, 2001, the Oncology Nursing Society had their annual congress in San Diego.
Mm,
And I was sent by the manager who hired me to attend
very nice.
congress.
Awesome.
And that was the start of my oncology career. Did not, I've not been to any nursing conferences before. Walking in the hallway, I saw one of the pioneers and leaders of the San Diego chapter of the Oncology Nursing Society, Cindy Jones. And she saw San Diego on my badge. She approached me and asked me to join the chapter. I did. The month after Congress, I attended my first chapter meeting. She introduced me to the group, and she basically told the group, "This is Marlon. He will be your future president." That was 2001, and I think I became president in 2005 or six. But that was one person. Yeah,
Yeah.
talking to her, and then her, I guess, being a sponsor, not even a mentor, but a sponsor to me at that time.
Yeah.
Took me to where I am, at least in oncology and in my nursing career.
That's amazing. And I always emphasize whether it's I'm with my students or with new nurses in the community that I have within my own setting. One of the things I always say is, have you been to a conference? If you haven't been to a conference, which one are you going to go to? Make sure that's on your calendar. Like I make it part of their goals that they are attending these conferences because it's such a great opportunity to network with people, meet people, just you never know who you're going to meet that's going to kind of set your trajectory in a completely different direction or accelerate your trajectory by just, introducing you or taking you under the wing, whether it's mentoring or sponsoring, as you mentioned. So really amazing things. So that's awesome. So education wise, how did you decide you're going to go back to school? Because I know that's sort of like my audience is a mix of various nurses from all age ranges, but a lot of them are fairly new, or some of them are even students that listen to the podcast. How did you, and I know between time and money and all of that you have taken into consideration. What made you decide that you were going to go for your master's and eventually your PhD?
Uh, it's all about relationships.
Yeah,
When I was a new grad, we had a clinical nurse specialist who just really looked up to. Regina Izu from UCSD. I hope Regina can hear this. And then she was amazing. Like she knew everything, and then I was just impressed listening to her, every time we have our classes. And that's or she made me consider going back to school as a clinical nurse specialist.
mm,
But in oncology, she was in cardiac care and critical care at that time. And then I said that, I want that role. I want what Regina's doing. So I looked for a program. Thankfully, UCLA at that time, UCLA School of Nursing had a clinical nurse specialist program specific to oncology. And I worked for the University of California, San Diego. So I was able to take advantage of the two-thirds tuition reduction uh,
nice.
for the master's program. And in 2004, no, in 2002, I actually joined the program and graduated in 2004.
Oh, amazing. Now you mentioned this is like triggered. So CN, I happen to have a number of friends that are CNSs. I greatly admire the work that in the specialty of a CNS within the world of nursing. I'm going to ask you, and this is just your opinion on this, but what's going on with nursing sort of moving away from the CNS role? Because I find it so vital that it's community based, it is specialty based. It's not like an NP, it's not like so what's going on?
The broad impact of a clinical nurse specialist, I think, cannot be overemphasized, right? A very important role in organizations at that time. But then we did not have a lot of programs. By we, I mean the entire country.
Right.
And hospitals then started to, again, my words, shoot ourselves in the foot by opening up those clinical nurse specialist positions to non-CNSs because we could not find CNSs at that time. And I think we did
Yeah.
ourselves a disservice by doing that.
Yeah.
So now, we can go by without CNSs because we've hired all these other folks into the position. Uh, and then the demand, it's just, demand suffered because of that, did not need CNSs, and more programs closed. And I
Yeah.
don't know that there are other CNS programs, at least here in the West Coast. I know there's still a few of them on the East Coast, but there's not a
Yeah.
lot here in the West Coast. I know Cal State has one. Uh, Cal State
Yeah.
Long Beach, I think, has a CNS program, but I don't know if any other programs, at least in Southern
Yeah.
California.
Yeah, I don't follow the CNS programs, but I know we have an active chapter to California. We has an active chapter for CNSs. So yeah, it's interesting that it's weird how sometimes the profession doesn't keep up with the trends and influence academia to grow some of the things that we know as a profession to have high impact in the community, but we don't do our due diligence in creating those opportunities and push, kind of put our foot down and say, hey, this is an important role for the community. We have nurse execs coming out of our ears. They're all over, but they don't emphasize it within the nurse. Like I can see a physician not understanding what a CNS does, but nursing does understand, and the fact that we don't advocate is bothersome for me. But anyway, I digress. So my apologies. Uh, so So you've done a lot. You are so let's talk about and you you've clearly done a you're a fellow of the American Academy of Nursing. So clearly you've had the opportunity to have significant impact within the profession. Um, Tell me a little bit about where you found the desire to say, you know what, I'm going to do more than what is expected of me, right? Like I'm going to take because that's really what it is like with a lot of fellows I speak to, a lot of nurses I speak to who are actively engaged in the profession of nursing, they go a little bit above, they don't go a little bit, they go above and beyond than what is expected and put a lot of their own time, energy, passion towards what they believe is what needs to be done. Tell me a little bit about your journey that eventually had you nominated and recognized.
I may have already mentioned this earlier. The primary impact that got me to the Academy of Nursing was the influence and impact I had in oncology nursing in the Philippines.
Wow.
So being very actively
Yeah.
involved with the Oncology Nursing Society at that time, being able to teach the chemotherapy provider course and then bring it to the Philippines, for patient safety and staff safety, bringing the actual course to the Philippines, and helping the Philippine Oncology Nursing Association continue that moving forward
Wow.
is what got me that impact on a country.
Yeah. Yeah. And it's amazing because that's like, that's huge impact that your work that you are able to take it from one location, take it to a completely different country and implement best practices. So amazing work. Very impressed. At what point, I don't want to lose track of the fact that you are a lieutenant colonel in the U.S. Air Force. How did that come about? Because that seems like your grandfather may have influenced you in this area as well, but how did that come about?
Yeah, that will be the interesting story, right? If I say that I joined the Air Force because my grandfather was a United States Armed Forces in the Far East. Well, uh, I'd be lying if I said that. I did not even see a picture of him in uniform. Did
Oh,
not
okay.
see any military medals, accoutrements anywhere at home, back in the Philippines or here in the U.S. at that time. It was really just a conversation I had with a chief nurse for the 452nd Aeromedical clinic at March Air Reserve Base, California. She was working as a case manager at UC San Diego at that time. Was walking to the cafe with her one afternoon, and she asked me if I ever considered joining the military. Uh, and I said, we haven't talked about this yet. When I could not get a job in San Diego in 1999, I actually did took the ASVAB,
Okay.
considered joining the Navy. There was a lot of Navy bases in San Diego. Thankfully, before they called me, the UCSD opened up, and I was the position. So that was my first, venture trying to get into military service, and then I forgot about that altogether after I got my nursing job. Fast forward to 2010, 2011, walking with the chief nurse, asking me if I ever considered joining, and then enticing me with, if you join the Air Force, you get to travel to other countries. You'll have 2 weeks. Exactly right. You'll have
That's the hook,
two
line,
weeks
and
of
sinker.
training, in Germany or Korea. So I said yes. And I figured, like, if I don't like this, I can always leave. Like, let me try what this is all about.
Yeah.
And then I got in, and then I learned that military did not have a lot of money at that time, so never got to go anywhere. Most of
Oh,
my training was on base. Uh, but that was one decision that I made. Remember, I said nursing was did not choose me. I did not choose nursing. Nursing chose me.
yeah.
Military was one decision I made, that for myself. Uh, first
And
couple
clearly you stayed.
Right, clearly I said first couple of years were rough, but as soon as I understood and then became enculturated, it became something that I really wanted to do and continue.
Yeah. And it's a little, I can't imagine. Like when I joined the military, it was just I went to active duty, so I was there 24/7. So enculturation was really like not a choice. You had to do it if you were going to survive. But I can't imagine, like people tell me I have a few friends that are reservists. I'm like, I don't know how you did it because you're not there all the time. You're there like the 1 week in the month, 2 weeks out of the year. Now once in a while you get activated and you get to play a little bit more. But like I can't imagine like just doing it one weekend without having that experience of being enculturated already into the military environment. So good for you. That's amazing. So what is your work in the I'm gonna ask just because I just had somebody reach out to me and say they were considering joining the military and wanted some insight. But now I'm gonna ask that question of you. Like, what do you enjoy about serving in the military?
It's the people you work with.
Yeah.
So I'm on my second position in the military. Prior to my current position, I was in the clinic. So I was actually working as a nurse in a clinic, in a deployment clinic. We
Right.
would assist with physical exams and immunizations, and that's the extent of what we do. We are not a treatment facility.
Yeah.
We would be reviewing records for military members who uh, if they're fit for duty. So those types of things, right? But it's sort of a case management job, and the only clinical job that we do would be taking vital signs and giving immunizations. Uh,
Got it.
and then I transitioned to where I am now in the Aeromedical Staging Squadron. And then for this, I have to learn the mission of my squadron, and that's in the event that we need to get deployed. I need to be able to function at the deployment location, as a nurse, transferring patients from the plane to the ambulance, picking them up, search and rescue, but mostly transport,
Yeah.
patient transport.
Yeah. So what do you like about it? Other than the people.
It's different from my normal job.
Yeah.
It's difficult. It's difficult. It's not a walk in the park. But it's not something that I do 5 days in a week, and I find it very interesting and learning a lot of new things.
Yeah.
Uh, I all I've known in my nursing career before joining the military was being an oncology nurse. And then I told you I was in the clinic, and uh, case management or reviewing records. But
Yeah.
now going to my new position in Aeromedical Staging Squadron, I became a trauma nurse trainer, learning tactical combat casualty course, and being
Yeah.
able to teach that, and it's challenging for me to learn all these new specialties, if you will,
Yeah.
in nursing. It just
Yeah.
challenges me, and I love that part of it, like learning new things.
That's awesome. That's awesome. Well, thank you for your service. I appreciate that. So I want to make sure we have enough time because I want to definitely discuss the your role as president of the Philippine Nurses Association of America. Can you share, before we get into really your role, can you share a little bit about the organization itself, and then we'll talk about more detailed stuff about your role with them.
Philippine Nursing Association of America was established in 1979. There were five chapters that got together at that time: PNA Southern California, PNA Michigan, PNA New York, PNA New Jersey, and PNA Illinois. And at that time, the issues that they had were related to the internationally educated nurses coming to the US, and inequalities. Uh,
Mm,
so they got together because of those issues. The issues now are still similar but different from
yeah.
what it was in 1979. But from those five chapters, we have now grown to 57 chapters and over 5,000
Wow.
members across the US.
Amazing. Amazing. So what is the work of the Philippine Nurses Association? Uh, what is your platform? What are you advocating for? What is your mission as a as a one of the handful of minority nurses associations? Because I know you guys are also like a member of the NSIMNA and
We're promoting and upholding the image of the Filipino American nurse in the US. Yeah, but
mm,
that's very broad. I mean, we do a lot of
yeah,
things. I tend to focus more on what we really do, right?
yeah,
What the grassroots do. And if you look at our chapters are very much involved in the community. So they do a lot of community outreach. Being a professional association, yes, we have our educational programs, and those are the things that we spend a lot of time and resources on. But for me specifically, being president, and with uh, what we are seeing currently in society right now, we're shifting our focus more on health equity,
mm,
and ensuring that we contribute to uh, achieving health equity in line with uh, the Future of Nursing 2030 document.
yeah. Now, if I was a Filipino, well, I'm going to assume that it's open to everyone who wants to join, right?
It is
Uh,
now, yes.
okay.
And you don't have to be Filipino. You just have to be able to support our mission.
Yeah. So having said that, if I was listening to this show, I'm like, that's a group that sounds interesting, but why should I join? Like, if I belong to American Nurses Association, I belong to my specialty organization, a couple of other things. What would be my thing? Like, what would be your sales pitch for me?
I'll go different. I'm not gonna go with the benefits that you can get. There are plenty, by the way, and then we could talk more about that. And if there's not enough time during this podcast, please feel free to connect with me and email me, and I can tell you about those. But I will channel my JFK. Ask not what your country can do for you, but ask what you can do for your country, or
Right.
something. I may have.
That's right. That's in line with what they said.
So being a member of PNAA, we need your voice for us to have a louder voice, and then not just for Filipinos, but also with our other allies. And you did mention we're a member of NSIMNA, the National Coalition for Ethnic Minority Nursing Associations. Five ethnic organizations that form an alliance to uh, all aligned with achieving health equity for all. So I need you to be a member of PNAA to help us with our mission, help us with our advocacies, help us be a louder voice. Many of the nurses that I have approached have said that they don't have time for it.
Mm,
And I may get hit for this. Like, I don't need you to have time. I just need you to be a member. I will provide the time and I will provide the efforts, but you provide me with the numbers.
yeah.
So I need you to be a member, and I will work really hard if you become a member to get all those work done on your behalf.
Yeah, and I think that's one of the things people or nurses don't always realize. Like, yeah, like you're encouraged to be an active participating members. Same thing with the American Nurses Association, right? We have a small percentage of nurses actually represented, right? They represent all of nursing, but only a small percentage of nursing actually belongs to the American Nurses Association, which is kind of a sad thing when you think about it. But the fact that you can say this is our membership of X thousands of people, that brings with it some actual clout when you go and try to advocate for things that are related to health equity, things that are related to changes in policy, things that make your representatives, your senators, your governors, your mayors, things like that, to kind of sit up and listen to you when you have the numbers in membership, people that have actually invested their money as to become members of the organization. And with, for example, for you to actually represent them in those situations. So I think a lot of people don't realize that. They think they have to go to meetings, which is fantastic if you have the time
Exactly.
and able to do. We'd love, like, I belong to a few organizations, actively belong to a few organizations. And I love the fact of being engaged in those organizations, but I also have the understanding that not everybody has that time, right?
Right.
But again, those numbers make a difference.
And then I have those specific numbers. I mentioned earlier that we have over 5,000 members. Well, there are, according to the most recent estimates, 180,000 uh, Filipino
Oh,
nurses
wow.
or nurses of Philippine descent in the US.
Yeah.
And you talked about the American Nursing Association. I heard estimates of what, 4 million to 5 million nurses in the
Yeah.
US. Imagine how powerful that block is for anything that we want to do.
Yeah.
It would be very impactful for me to say, hi, I am Marlon, president of the Philippine Nursing Association. I represent 180,000 nurses
Yeah.
compared to I represent about 5,000 members.
Yeah. But you're advocating for all of them,
We are
right?
advocating for all of them.
And, just like the other nursing organizations, they advocate for all of them or try to. So it's, yeah. So the fact that we don't have the engagement, like in the nursing overall, I think we don't have the engagement we need to have. And I think part of it, I blame schools quite a bit on this, because not enough faculty in schools introduce their students to what nursing organizations are and what they do for you and how to engage with them. So I think that's problematic. And then
Yeah.
once they go into the service side, once they start working again, that you never hear about it again. So
One of the statements that really stuck with me was and I don't even remember where or who I heard it from. They told me that once you get your nursing license, as soon as you get that nursing license, then you sign a social contract.
yeah,
And that's what those professional associations stand for. That's the
yeah,
social contract that we as nurses do not only do our job at the bedside or whatever your role is, but we have a responsibility to society in general. And that's what our professional associations do.
yeah. I 100% agree. So you kind of already talked about your role. What is your platform as the president? And you are the president for the 2024 to 2026. So this is your first year on the job?
Yes, I just barely got past my first 100 days.
Okay. All right. Your brand spanking new. I didn't realize that. So what are your personal, because every leader in an organization comes with their own personal goals. So what are some of your own personal goals for the organization, since you have a good almost 2 years left?
So I'll go to my mantra, I squared, influence and impact.
Mm,
How can we make a deeper impact in everything that we do? Nothing specific in everything that we do, and how can we extend that influence?
yeah.
So we've talked about some of them, like increasing our membership. Every single member extends the influence of your organization through their actions, through their voice. In terms of impact, it's looking at how we do things and asking ourselves, like, how can we better provide the service to our constituents and our community partners.
Yeah. If you had your wish list other than membership growth, what would you like that to be for the Filipino Nurses Association?
Uh, I have to be very careful.
No, you don't. It's all good. Just speak your mind. Speak your mind.
So we have some processes that are outdated, right? When you look at policies of the organization, like I said, we were founded in 1979. We really need to look at our mission, our vision, our policies,
Yeah.
and make sure that we're aligned with where we are right now, 2024, and what's going on with society.
Yeah.
So we're already starting to make that happen. We will have a visioning retreat in April of 2025.
Very nice.
None of the things that I'm doing right now will affect my presidency, but this will be for the succeeding terms. And I've worked with our president-elect who will be taking over in 2026. I'm working with the executive board, those who may want to be president, and telling them how important this is, to really look at where we see ourselves 5 years from now, 10 years from now.
Yeah.
And then all this came from 2000 to 2022, while we were in the middle of the COVID pandemic, right? And we started asking ourselves, like, what are we here for? What are professional associations here for? And then we really needed to pivot many of the things that we're doing and really look at ourselves deeply in terms of, what do we want to do?
Yeah.
And be aligned with changes in the world.
Yeah, that makes sense. That makes sense. Now, since you are looking to re-envision some of the things, what are some, and I once in a while I ask my guests this, is what do you see as some of the barriers within the profession that continues to at times keep us from moving at a faster pace or staying current with where society is? Because I think sometimes we run into, you see pockets of innovation and influence that are moving, but as a profession, sometimes I feel like sometimes it feels a little bit stagnant and we're just not moving. What do you think? For you, anyway, how does that not? You can take your president hat off, but like for you, how does that translate for you? Like, do you see that, or are you guys like moving 110 miles an hour?
No, I do. I do see that, and then not just with PNAA, but with many other organizations.
Yeah,
I think as a profession, we have done well with evidence-based practice, right?
yeah.
We're using evidence to improve our practice, to be better able to provide care, keep our patients safer. That has not really translated to sort of leadership and organizational science.
Mm,
Many of the things that organizations do is based on long-held traditions in the organization. And I think it is really important to look at leadership, organizational science, and see what works and what doesn't, and be more future thinking and be more open to
yeah,
changes.
yeah, yeah, yeah. I think I once in a while I give presentations, and it feels like similar topics of, why aren't we doing this, or we should be doing something, and so many people come up to me like, oh my God, you said it. I'm like, why are we just not doing it? It feels like our fingers on the trigger, but nobody's willing to, not to make a shooting thing, but reference, but like we have the opportunity, we have the numbers, we have the opportunity, but we don't always execute on that vision. And I don't understand it. And I think hit the nail on the head is what I'm trying to say. On the fact is like we have these long held traditions that we have to do things a certain way, but that's not always the case. It's just a matter of like, let's just do it, right? I feel like like a Nike commercial all of a sudden. Just do it. Just like it takes us forever to like take a step forward. Sometimes it feels like sometimes. So between the meetings and meetings and meetings and meetings at the end, it's like Jesus. So anyway,
Use the same principles that we use. I talked about evidence-based practice. We could
yeah,
use the principles of continuous quality improvement, like small incremental changes. Just do it, like you said.
yeah,
I think we
exactly.
overthink things.
Ah, geez,
Like if we make a
yeah,
decision, what are and we tend to overthink things.
yeah,
PNAA knows. Like I've said this many times. Let's do it, and if we're wrong, we'll change it back.
right. Like I saw, like it's like especially on things that aren't patient
Right.
care
Not
like
gonna kill
related, right? I'm
anyone.
not going to kill anyone if we try this thing. So I agree with you. So I want to be super cognizant of your time. I know you're a busy person between all your jobs and everything that you do. But I want to give you a few minutes for anything else that you want to share with the audience.
Uh, I don't think I have any. If you're a Filipino American nurse or a nurse of Philippine descent, I invite you to be a member of the Philippine Nursing Association of America. If you are considering joining the military services, let me know. I will connect you. You have to join the Air Force, though, not the
I
Navy.
don't know about that. You're
I
gonna.
will connect you with an Air Force. And if you want to work for me, for us here at the Providence St. John's, let me know as well. We have positions. But whatever it is you want to do, find a mentor, find a sponsor, and just do it. I think that's the word of the day from Alvin.
Yeah, yeah. Well, I appreciate that. Or if you just want to support any of these organizations, there's way to support them as members or affiliates of all these organizations as well. There's a way to support our veteran community too, and Veterans Day is coming up, November 11th. November 11th, right? Yeah, I'm not. Yes, November 11th. I had to question my because the Marine Corps birthday is right before that, so I have to make sure I'm getting my dates. Sometimes they get mixed up. So thank you so much for your time. I will have Marlon's full bio and links to the Filipino Nurses Association of America available on the website. So please check it out. Appreciate everybody listening and looking forward to bringing you more of our incredible nurse colleagues and their stories and the incredible work that they're doing, not only nationally but internationally. Thank you so much for joining me again. Have a great rest of your day. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.